Hi, here I am Dr. Azal with a topic kidney stones, also called renal calculi. In medical terminology, we call them nephrolithiasis. Urolithiasis. This affects 5 to 10% of the population and is one of the most common cause of attendance at accident and emergency department with abdominal, flank pain, loin pain, hematuria, sepsis, and dysuria. According to data, renal stone formation is 3 times more commoner in males as compared to the females. And high body mass index is associated with increased risk of stone formation. Kidney stone formation does occur when there is an excess of crystal forming substances that cannot be dissolved in urine, such as calcium and oxalates. The contributing factors are like as disturbance in urinary pH, low urine volume, decreased fluid intake, dietary factors, urinary tract infections, and urinary stasis due to anatomical narrowing, diverticular tumors, or foreign bodies. If stone lodges with no obstruction of urine flow in renal pelvis, then it's asymptomatic. However, in ureter, if stone lodges may cause increased pressure inside the ureter, spasm of smooth muscle lining, distensions of wall, renal colic, nausea and vomiting, and condition may lead to hydronephrosis and hydroureter. And when renal stone reaches into the bladder, then may present with frequent painful urination, chronic bladder discomfort, cystitis, and hematuria. In this picture, you can see areas of the kidney, ureter, and bladder where stones are likely to occur. They are usually formed in the kidney and move distally. Stones resulting in pelvic-ureter junction obstruction may cause deep flank pain and is a result of renal capsular distension. As the stone moves from upper to the lower ureter, the site of pain may shift from loin to groin, and pain at the tip of penis or testicle might indicate a stone lodged at vesico-ureter junction. Actually, the location and severity of pain is related to the location of the stone and also to the degree of obstruction. Smooth muscle, ureteric obstruction, and presence of infection. However, the complete obstruction can sometimes be painless. Renal stones are classified such as the radio-opaque stones and radiolucent stones. The radio-opaque stones are usually containing the calcium, such as the calcium oxalate that is 80% commoner, steroid that is also called the triple phosphate that is 10%, usually opaque but variable, and third is the calcium phosphate. The radiolucent stones are like as uric acid that is 9% and cysteine and xanthine that are 1%. This is a calcium oxalate stone. These stones are relatively small and most are 7 mm or less, usually pass without surgery and intervention. Causes are like as heredity, diet, and living habits. This is a picture of triple phosphate stone made up of magnesium, ammonium, and phosphate created by a certain type of bacteria. These stones are irregular, jagged with jagged edges, and can grow to large size, so called the Staghorn stones. This is a picture of calcium phosphate renal stones. They are similar to calcium oxalate stones, not common, typically larger than the calcium oxalate stones. They are formed when urine is alkaline. This is a picture of uric acid stone, and these uric acid stones, they are formed when urine is acidic. They are often red, orange in color because they can become large and can cause serious problems. They are often related to gout condition and in those who consume high protein diet. In this picture, you can see the cysteine stones. These are found in inborn hereditary kidney disorders called the cystinuria. The treatment for this type of stones will be lifelong as the condition cannot be cured. Ultrasonography is the investigation of the first choice. In this sonograph, you can see a renal stone with posterior acoustic shadow. Although 90% of stones are radio-opaque because of calcium content, the sensitivity of plain X-ray in detecting urinary tract stones is only 50%. In this picture, you can see there is a left renal stones in plain X-ray film. IVP is a traditional radiological study of renal parenchyma, pelvic calyces system, ureters, and urinary bladder. In this IVP spot film, you can see a filling defect, most likely suggestive of left lower calyx stone. There are a number of sonographic renal artifacts, vascular and non-vascular, which may mimic renal calculi. In this sonograph, you can see echogenic area without posterior acoustic shadow, suggestive of artifacts.